Callus, corns and warts are very common, and I see them just about every day in my practice. They each have different causes and therefore have different treatment requirements. Let's start with callus. Callus is a general thickening of skin over a relatively large area. It is caused by mechanical factors such as an increase in pressure and friction. They are commonly found on the ball of the foot. They have a yellowish appearance and are often not associated with pain. Corns are also caused by friction and pressure, however, over a much smaller surface area. It results in a cone-shaped thickening that gets pressed into the skin. I most often see corns on the tops and the outsides of the baby toe, on the tips and the tops of claw toes and hammer toes, and also under the ball of the foot. They are often associated with pain, but not always. Warts are somewhat different because they're caused by a viral infection. The human papillomavirus has many strains, and only a couple of them like the feet. Their appearance is different to that of corns and callus. They are often an uneven surface with a rough appearance. It's often described as a cauliflower appearance, and often they have little black dots inside. Size varies. Also, the amount of warts on a foot varies, sometimes with just one, and sometimes many warts, sometimes on one foot, sometimes on both. They may or may not be associated with pain, and that's often got to do with where it is on the foot. If it's under a weight-bearing area, it's often uncomfortable, but if it's on an area of the foot that doesn't bear weight, it's not always painful. Warts on other parts of the body often protrude or stick out, but because we stand on our feet, warts underneath the foot are pushed into the skin. So you can see how warts and corns would present similarly and need to be differentiated to ensure appropriate treatment. Treating corns and callus is about addressing the mechanical factors. We look at where are the high pressure areas, why are they there, and what can we do about them. So we look at things like, we look at the person walking. So might it be inefficient mechanics or biomechanics that are causing the pressure? And we address these often with insoles or padding to redistribute and offload those high pressure areas. Sometimes it's the shoes. They might be too small or inappropriate for the activity, and we address that by making suggestions for the most appropriate footwear. And if it is due to deformity, then we look at offloading in other ways with padding and cushioning and things like silicone toe caps. For warts, we have to address the viral infection, and there are many ways to treat warts. Some of the treatment options may include daily application of a particular paste or ointment. Other options include freezing, burning, and also needling. So because these things present similarly sometimes, and because they have different causes, they have different treatment requirements. This is why it's important to seek professional medical help when you have a lump or a bump or a funny skin thing on your foot.